Assalamu alaikum wa rahmatullahi wa barakatuh. Hey, I am Dr. MD Rokan-Uzzaman from Mirpur 1, Dhaka, Bangladesh. Hello viewers, how are you everybody? I think you are all are fine of your own place with your family. A small message for all of you. Always remember, this is the dangerous period we go live. Please be careful from COVID-19 virus. Wash your hand by soap 5 to 6 times and use face masks. Take COVID-19 vaccine. Stay home, be safe. I would like to discuss about diabetic or high blood sugar level. Please stay some time with me and I request you everybody please like, share, comments, subscribe and turn on the bell icon for future newly uploaded video you can see first. What is diabetic? Diabetic is a chronic disease that occurs when the pancreas is no longer able to make insulin or when the body cannot make good use of the insulin it produces. Insulin is a hormone made by the pancreas that act like a key to let glucose from the food we eat pass from the blood stream into the cell in the body produce energy. All carbohydrate foods are broken down into glucose in the blood. Insulin helps glucose get into the cells. Not being able to produce insulin or use it effectively leads to raised glucose level in the blood. Over the long term, high glucose level are associated with damage to the body and failure of various organ and tissue. Glucose is the main source of energy of our body. It is not only helps make up our body cell, muscles and tissue, but also acts as a fuel for our brain. The glucose of sugar level have to be maintained fairly constant in the body. The excess of sugar in the body leads to various health problem. Cases of diabetic. The cases of diabetes person to person. It is considered a genetic disorder and run in families. However, anybody can suffer from it, even if it does not run in your family. Some risk factors include sedentary lifestyle, unhealthy eating habits, extremely stressful life, lack of sleep, etc. Those factors increase the likelihood of getting diabetic. Type of diabetic. There are two types of diabetic, type 1, type 2. There is also a cell petibates which is a reversible diabetic. It is mainly causes of during pregnancy when sugar level are high than normal but not so high as to classify as diabetic. In such people, usually the sugar level come back to normal on the baby is delivered. Type 1 diabetic. Usually it appears in childhood or teenage life. However, it can occur at any age. Type 2 diabetic. Most of the time it appears at an older age, that is after 40 years. However, this type can also be at any age of life. symptom of diabetic. The symptom experienced by each individual depended on how much the sugar is increased in your body. The most common symptoms are frequent urination, increased thirst, increased perspiration, high appetite or increased hunger, weight loss without any diet or without any reason, fatigue, wounds take a longer time to heal than usual, prone to frequent infection, presence of ketones in the urine. Homeopathic remedies. Here is list of best, especially homeopathic medicine for the treatment of diabetic. But remember, below mentioned remedies are very special remedy. These remedies work well when given with classical remedies, which are usually prescribed after considering the complete history of the patient. Number 1, Syzygium jambugium mother. This remedy show immediately effect on the increased sugar level. This is the most common remedy included of high sugar level. Usually the symptom associated with the remedies is prickly hurt in the upper part of body, causing intense itch and small red pimple like eruption, constant urge to urine with high thirst and general emaciation. This remedy is also indicated in diabetic who have developed diabetic skin ulcer. This remedy can be taken in the form of mother tincture, 15 drops in half cup of water, and with another mother tincture, Zymnista silvestre, Abrotoma augusta, hydrocotyl asparagus mother. Doses are as Syzygium jambugium. Number 2, Halonesia. Halonesia indicate in diabetic patient who suffer from frequent urination. The color of urine is very whitish and clear due to passing albumin in the urine. Mentally, those patients have very weak memory, are extremely melancholy and depression people. They are very irritable people who cannot bear slightest consideration. They are always better when they keep busy doing something or when the mind is engaged in work. This remedy work well when take 2-3 drops twice daily 2 to 3 months in 30C form. Number 3, iodine. This remedy is included the diabetic people who have extreme hunger and appetite, however, still they emaciated. Mentally, such patients have a tendency towards anxiety. There they are so anxious that they cannot keep still, so they keep moving to working but come extremely exhausted by working and also sweetest extremely from the slightest exertion. This remedy can be taken in lower potency like 6, 12 or 30C. Saphalandra indica. This remedy has been proven scientifically very effective in lowering and maintaining the blood sugar level and healing diabetic related symptoms. It is indicated in diabetic people who have been suffering from intolerable burning pain all over the body with profuse urination. It is also effective in delighting with frequent urination and thirst in diabetic, where patients feel weak and exhausted after passing urine. This remedy is proven effective the treating diabetic related complications like burning in limbs, muscular tenderness, etc. It can be taken in the form of mother tincture, 15 drops twice a daily, half cup of water for 1 to 2 consecutive months. This can be taken alone with allopathic medicine. However, it is advised to keep a check of your blood sugar level, reduce the dangers of doses of allopathic medicine as per required. Uranium nitricum. This remedy works well when a patient suffers from diabetic and gastric problem together. This is an excellent remedy for increased urination, increased appetites, excessive thirst with nausea, vomiting, burning in the stomach due to gastric ulcer. The remedy can be take in 3x or 6x form. Kindly note that is advisable to consult of your physician whenever you take homeopathic remedies along with allopathic medicine, as you are likely to see some function in the sugar level. Do not stop allopathic remedies or insulin injection without consulting your physician. If your blood sugar is too high, you will receive intravenous fruits, supplement of phosphate, sodium and potassium, insulin. If your blood sugar is too low, you will receive glucose, intravenous fruits, 50% dextrose solution. Thanking you everybody. See you again another time with another topics discussion. Allah Hafiz.